To make your experience with EMDR therapy as beneficial as possible, it's good to be prepared for what will actually happen at the beginning of treatment. Some patients come to therapy with strong expectation that EMDR will help them in the first few sessions, while others expect a dramatic experience like watching a thrilling movie. It is essential to begin treatment with realistic expectations about EMDR therapy. Let's discuss what your first session may actually be like and how you can stay committed to the process and improve your mental health. Do you remember what happened when you started doing something new for yourself? While it's exciting, everything feels unfamiliar, so your brain and body on high alert. The same things happen when you meet a new therapist for the first time. People in New York are diverse, and therapists there also vary. Some may have accents or backgrounds different from yours. Of course, you could spend time and find a therapist who looks, sounds, and thinks like you, but think twice. Is it really what you want to do? Is that what brings you there? It's important to take time to get to know your therapists, become comfortable around them, so you can relax your mind and body for your treatment to be effective. The early sessions focus on creating safety and building trust, which helps your nervous system relax and be ready to do some healing work. Also, the first sessions, your mind and body may not be ready for major changes yet, and reaching this stage varies from person to person. You can't push yourself through it. It takes some time. Personally, I work through my trauma in EMDR sessions and experienced significant change after just 2 sessions. However, I have been working with the same therapist for about 4 years before that, and we already had a trusting therapeutic relationship. Even though my therapist was not extensively trained, I still achieved outstanding results in those 2 EMDR sessions. To my advantage, I was already an EMDR therapist myself and knew how it works, what to expect, and what isn't. It is important to note that EMDR is not solely the therapist's work. It's the work of your body and mind when you are ready to engage in this process. It is helpful to understand that EMDR therapy first started with veterans who faced severe combat trauma, often seeing their traumatic experiences as isolated life or death events. The sessions were intense and profound. Today, EMDR is used for all types of trauma, whether big or small. We don't compare traumas because pain is pain. However, when a patient comes to treatment and expect a miracle after just 1 or 2 sessions, they may be disappointed with the outcome. We cannot predict when or how change will occur. Everyone's pace is different, and that is perfectly okay. A trained therapist will guide you through the process in a way that aligns with your unique story. When therapy ends too soon, unresolved patterns continue. The work you began remains unfinished. Healing, like any meaningful project, takes patience. EMDR work through consistency, not shortcuts. Give yourself 8-10 sessions. Stay present. Trust the process.